Cryptic pregnancies. What are they? What is a cryptic pregnancy? A cryptic pregnancy is any pregnancy where the mother is unaware that she is pregnant for part of a pregnancy, most of her pregnancy, or when she finds out she is pregnant during or after labor. It could also be any pregnancy where the mother knows she's pregnant, but she cannot get medical care because the doctor or doctors refuse to believe she is pregnant due to false negative pregnancy tests or other medical reasons. Why is this pregnancy cryptic? Continued menstruation, that is, you can actually have periods while you're pregnant. Yes, it is possible. You could be one of those people where their periods have always been irregular, and you're not having a period for 9 months. It's just normal for you for whatever reason. You could be getting false negative pregnancy tests, both over the counter and blood tests at the doctor. These could be caused by fluctuating hormones, caused by stress or some sort of medical issue, or it could be caused by low levels of HCG, which can be caused by all sorts of things. Your baby could be carried on your spine. You could have no pregnancy symptoms at all, or if you have them, they could be easily explained away by other issues. Your view of your baby could be obstructed, and it could also be cryptic as a result of the mother's taking birth control. So, well, I'm taking birth control, so I can't possibly be pregnant. Mother is believed to be infertile or has been fixed. So if she's been fixed, or if she's been told her whole life that she's infertile, well, why would she be pregnant? That's just not something that's going to cross her mind. Known causes for cryptic pregnancy are fluctuating hormone levels, which can be caused by polycystic ovarian syndrome, or PCOS, a recent pregnancy, perimenopause, low body weight, stress, or birth control, possibly among others. Common signs and symptoms of cryptic pregnancies can include period-like bleeding throughout pregnancy, which is mistaken for normal menstruation. Pregnancy symptoms, if you have any, which are easily explained away by other medical issues. Fetus in a cryptic pregnancy will present just like a typical pregnancy, except that it will likely be nestled against the spine. Movements of the fetus may go unnoticed, as they will likely feel like gas passing through your body. Other common symptoms may include bleeding or continued periods. A woman having a cryptic pregnancy may continue to bleed like she would during a typical menstrual cycle. This bleeding will likely be for a short duration, and flow can range from heavy to spotting and could be pink, brown, red, black, or purple, or possibly even orange. This is caused by the uterus removing its inner lining and likely does not indicate a miscarriage. Basically, you're having a period and shedding your uterine lining even though you're pregnant already. Weight gain or loss. Any weight loss will be gradual and likely will occur due to food aversions or morning sickness. Any weight gain will be very slow and will not follow a pattern similar to typical pregnancies, meaning it is very unlikely the mother will show. And if she does, it won't be noticeable to very many other people. Because the mother doesn't know she's pregnant, she will not be ensuring she gets adequate nutrition for her baby, and she will be very unlikely to receive any medical care during the pregnancy. How long can a cryptic pregnancy last? The gestation period for a cryptic pregnancy is much longer than that of a regular pregnancy. This is because the HCG hormone is not absorbed by the body, and so it does not get the signals to focus on developing the fetus. Regular periods also prolong the gestation period. In fact, the gestation period is correlated to the flow of the period. The heavier the flow, the longer the gestation period. Cryptic pregnancies can take more than 40 weeks and have been known to last for as long as 2 whole years. Can a cryptic pregnancy go undetected in an ultrasound? If a woman doesn't believe she's pregnant, she will not get ultrasounds as often as pregnant women should, if at all. Due to this, many cryptic pregnancies may go undetected even by ultrasounds. Reasons why a cryptic pregnancy may go undetected during an ultrasound include scar tissue, which blocks ultrasound waves and makes it difficult, if not impossible, to get a complete picture of the uterus. Past surgeries performed on the stomach can cause abnormal scarring, which can block the ultrasound waves. Retroversion of the uterus. It may be difficult for an ultrasound to detect a fetus if the uterus is retroverted, because the uterus is tilted. The uterus could be tilted to the side or towards the back. In either case, this will make detecting a fetus more difficult. Bicornuate uterus is a condition in which a woman is born with a uterus which has grown in the shape of a heart with 2 horns, where the uterus is partly or completely divided by a wall of tissue. This makes it difficult to detect a baby during an ultrasound, as each half of the uterus may appear to be a complete uterus by itself. If an ultrasound tech sees an empty uterus, they may not think to look for another uterus. This also makes it more difficult for a woman to conceive. Complications of cryptic pregnancy can include lack of access to medical care during pregnancy, due to the mother being unaware she is pregnant. This can lead to prenatal issues such as gestational diabetes and gestational hypertension being left entirely untreated. As the mother does not realize she's pregnant, she will fail to avoid behaviors which are known to be harmful to a growing fetus, such as drinking, smoking, and lifting heavy objects. Can cryptic pregnancies be prevented? Unfortunately, cryptic pregnancies cannot be prevented. If you have any changes or unusual pains in your abdominal or pelvic areas, then you should consult with your doctor about the pain. If your periods are irregular, you should tell your gynecologist so they can do a thorough checkup to figure out why. Cryptic pregnancies are difficult to detect and can make life difficult, as they don't give you adequate time to prepare for your growing bundle of joy. Be aware that this can happen to any woman of reproductive age, and don't keep your doctors in the dark about anything you suspect could be pointing to a cryptic pregnancy. Well, I was going to share with you all my personal experience with cryptic pregnancies in this video. However, as it is already getting quite long, I feel like I should share it in a separate video. If you liked this video, please like, comment, share, subscribe, hit the bell, and tell all your friends about me. I hope you have all have a great day, and if you're having a cryptic pregnancy, I hope you get your care and all that, and that you have time to prepare. Good luck.